Welcome to your course video lecture notes with Dr. Chandler on Insight Therapies for Psychological Disorders. Let's begin. Broad categories or approaches to treatment include behaviorism and insight therapies such as psychodynamic, humanistic, and cognitive. There are also combinations of these therapies which are known as having an eclectic approach. This lecture focuses on the three major psychological insight therapies. By some counts, however, some 400 identifiable psychological therapies exist. The most influential styles of psychotherapy build on psychology's major theories: psychoanalytic, humanistic, behavioral, and cognitive. Psychotherapy typically involves an interaction between a patient or client and a clinician. Although some therapies are carried out in groups, treatment of emotional, behavioral, and interpersonal problems through the use of psychological techniques designed to encourage understanding of problems and modify troubling feelings, behaviors, or relationships. Here is a diagram showing the promise of psychotherapy, how therapy with efforts to change can affect maladaptive behaviors, distorted thoughts, inner conflicts, and interpersonal relationships. Freud proposed that we are motivated by unconscious drives of aggression and sex. Acting on these drives is not always compatible with social norms. A conflict is created, and we use repression, denial, or other defense mechanisms to maintain a positive view of ourselves. According to this theory, repressed or denied drives affect moods and behaviors. Psychoanalysis attempts to increase awareness of conflicts and work through them. Freud's psychoanalytic couch is displayed at the Freud Museum in London. All of Freud's patients reclined here, while Freud sat in the chair at the head of the couch, close to but not within view of his patient. Freud believed that dreams and other projective techniques are pathways to the unconscious. Terms that he created as part of psychoanalysis include manifest content of dreams, free association, interpretation, resistance, transference, and countertransference, as well as the defense mechanisms, psychosexual stages, and projective techniques of Rorschach, ink blots, and thematic apperception tests that we've studied previously. Here's the iceberg model of Freud's psychodynamic theory to keep in mind when thinking about the aim of this therapy to expose the unconscious with projective techniques and dream interpretation. Here's a diagram showing how Freud's psychoanalysis focuses on breaking through defense mechanisms to help individuals to gain insight into their inner conflicts and repressed wishes. Freud believed that once awareness of these penetrated patient defense mechanisms and moved into consciousness, disorders would fade away. Unfortunately, there is little research evidence of this outcome. Strengths of psychoanalysis are that this therapy is still in use today. Impact of work is extensive. Focus on importance of early childhood experiences and how these shape personality is continued in many therapies today. Weaknesses of this theory include the subjective interpretations make it difficult to empirically evaluate. The difficulty in knowing if unconscious is ever actually tapped, and current updates and changes to psychoanalysis comprise a shorter time in therapy, using face-to-face dialogue with feedback and advice. Rogers and Maslow emphasized the positive nature of humans and concentrated on the present and current problems. They recognize that humans have basic biological needs for food and sex and a desire to form close relationships, treat others with warmth, and to mature as individuals. Keys of humanistic-centered therapy are the belief of the individual's natural tendency toward self-actualization, but that the family and society may hinder growth and can cause an incongruence between the ideal and real self. Remember, this is the opposite underlying philosophy of the psychoanalytic theory of personality. In humanistic treatment, the goal is reduction of incongruence between these selves within the therapeutic alliance. Here's a reminder of Maslow's humanistic model of personality, the hierarchy of needs. This diagram is an overview of humanistic therapy called client-centered because humanistic psychology is based on the theory that each of us is an expert on ourselves and cannot direct the goals of becoming more fully functioning for anyone else. Rogers believed that mental disorders stem from unrealistic conditions of worth acquired in life. Client-centered therapy seeks to change such beliefs primarily by placing individuals in an environment where they receive unconditional acceptance from the therapist. Remember, this method of treatment is known as stroking the deviance and is contraindicated for individuals diagnosed with personality or character disorders. Humanistic therapy, devised by Carl Rogers, focuses on building a therapeutic alliance between the therapist and client to establish a strong and trusting relationship. Here's a picture of Carl Rogers conducting group therapy. This form of therapy allowed more people to be able to access and afford therapy. The components of a client-centered therapeutic alliance include mutual respect and caring, empathy, unconditional positive regard, genuineness, and active listening. Benefits of group therapy include how adaptable this treatment can be within the changing demands of the clinical field. Group therapy is effective as individual therapy for many situations and the preferred approach for interpersonal issues. Challenges of group therapy are similar to other therapies in that outcomes are dependent on the therapist's skill and clients may demonstrate resistance or transference. Self-help groups such as AA, Weight Watchers, and Parents Without Partners provide support, not therapy, and are often led by mental health advisors rather than a trained therapist or psychiatrist. Group therapy includes family and couple therapy. For some individuals struggling with psychological problems, group therapy is a good alternative to individual therapy. Study the strengths and weaknesses of this form of therapy from your text. Strengths of client-centered therapy include the significant impact on the practice of psychology of this treatment. This form of therapy is now used by many therapists from a variety of theoretical orientations. Weaknesses of this theory are that the methodology are not easily operationalized, which you remember means difficult to measure. Also, this therapy requires a high level of verbal skills and self-awareness of the client, so those with severe psychological disorders, such as schizophrenia, would not benefit. Beck's cognitive therapy addresses automatic, disordered thought processes believed to lead to psychological problems of maladaptive behaviors and feelings. In therapy, mental frameworks with cognitive errors or misinterpretation of life events are replaced with more positive beliefs. Beck contends that psychological problems stem from distorted patterns of thought. Cognitive therapy aims to replace these cognitive distortions with more realistic and constructive ways of thinking. Negative emotions arise from irrational interpretations of experiences and their negative beliefs, such as arbitrary inferences, selective abstractions, overgeneralizing, magnification or minimization, dichotomous thinking, that's either or thinking, and personalizing. The cognitive therapist helps the client to recognize their particular irrational beliefs and challenges the client to develop more realistic views after seeing that the irrational beliefs are unreasonable and emotionally harmful for the client. This diagram indicates how Beck's cognitive behavior therapy is designed to change the automatic cognitive tendencies, called distorted thinking, that contribute to depression. Unhealthy patterns of thought produce negative affect or mood, which then increase the likelihood of further negative thoughts. Cognitive behavior therapy attempts to break this negative feedback cycle. Here is a specific example of how common irrational beliefs associated with emotional responses are due to irrational interpretations of experiences and negative beliefs. The therapist helps the client recognize irrational beliefs and challenges the client to develop realistic views after seeing how their irrational beliefs are unreasonable and emotionally harmful. Note the use of have to, must, and other definitive constructions in the statement of irrational beliefs. The belief, I have to get this done immediately, I must be perfect. The belief, everyone is watching me, I won't be able to make friends. The belief, I'm a loser and will always be a loser. The belief, she did that to me on purpose. All of these bring anxiety, sadness, anger, the feelings associated with the thoughts. Ellis's rational emotive behavior therapy also has an emphasis on unrealistic beliefs, often perfectionistic in nature. Think about how we believe that we and everyone else should think and act, which leads us to disappointment about how we and everyone else thinks and acts. The goal of therapy is to change irrational thoughts to realistic thoughts and to develop self-acceptance. This therapy focuses on change of behavior and thoughts or cognitions. The overlap of Ellis and Beck's cognitive approaches are both short-term, action-oriented, and homework-intensive kinds of therapy. Psychological therapy is cost-effective, reduces disability, morbidity, and mortality, improves work functioning, decreases the use of psychiatric hospitalization, and according to the American Psychological Association, or APA, leads to the reduction in unnecessary uses of medical and surgical services. Effectiveness overall is that psychotherapy shows solid evidence for working, especially if it's long-term. All therapeutic approaches perform equally well, but are limited by insurance companies in terms of the therapist's choice and therapy duration. The results of an effectiveness study involving thousands of participants indicate that therapy works. Large proportions of those who receive therapy from trained psychiatrists, psychologists, and social workers reported feeling much better as a result of treatment. Unfortunately, research suggests smaller proportions of individuals getting improvement after visiting marriage counselors or physicians. This pie chart indicates the proportion of individuals that reported being helped with their problems, whether the help was from psychologists, family and friends, their church, or other medical practitioners. This chart shows the percentage of psychologists from among 1,000 members of the American Psychological Association's Division of Psychotherapy who have various primary psychotherapy orientations. Orientation of clinical psychologists in the APA Eclectic Psychotherapy draws on techniques from different forms of therapy depending on the client and the problem. Note the styles from which psychotherapists with an eclectic approach may choose to adopt. Remember, variations of humanistic, such as existential, and the expansion of the behavioral theory into social learning approaches. The portions of this graph are approximate, as they vary from year to year as some approaches become more popular with new graduating psychologists and as existing psychologists retire from practice. Not if, but when you think you need help, you should seek help. Figure out what kind of therapy will work and find the right therapist. Therapy needs to be a match of the therapist, the client, the specific complaints and symptoms, and the kind of treatment. Unfortunately, when these characteristics are not aligned, therapy can sometimes make problems worse. Does Facebook have a place in therapy? Research indicates that the relationship between therapist and client should remain a professional one, both online and offline. Therefore, the emergence of social media presents new challenges as well as new opportunities for individuals and therapists. Remember that character or personality disorders such as narcissistic personality or borderline disorders can be made worse with humanistic and psychodynamic therapies. Those with these kinds of disorders benefit with behaviorism or cognitive approaches. Fortunately, those with the most commonly experienced disorders such as anxiety and mood disorders can benefit from psychodynamic, humanistic, cognitive, and behavioral therapies. Psychological disorders can be prevented by societal programs that identify and alleviate the conditions that help foster poor mental health. Preventative mental health programs seek to replace repressive and oppressive, esteem-destroying environments with nurturing environments that foster self-confidence and individual growth. Following this series of lecture notes, you will have some multiple choice questions.